The discovery of antimicrobials is one of the biggest miracles of modern medicine. But microbes are adopting and building resistance to these medicines faster than we can develop new and effective antimicrobials. Already, the social and economic consequences of this problem are staggering.
Drug-resistant infections increase the death cases and healthcare costs due to difficulties in treating these infections.
And in a world wherein we all expect to get cured after proper diagnosis because we have the antibiotics at the tip of our fingers, are we going back to the Stone Age wherein a disease that could have been cured before cannot be cured now?
The doctor or the medical practitioners, they would prescribe the antibiotic very indiscriminately. What they should do is to be careful of what they prescribe. Sometimes very simple, normal practice now, even a very simple illness like URTI, for example, they're given antibiotics, which is probably not necessary.
In 2014, at the 65th Committee meeting for the Western Pacific, member states endorsed the Action Agenda on Antimicrobial Resistance in the Western Pacific. Countries agreed to raise awareness, develop national plans, and strengthen their health systems to contain antimicrobial resistance.
No single country or organization can take it on alone. This is why the World Health Assembly called on all member states to adopt, over the next 2 years, national action plans on AMR as part of the Global Action Plan.
The Global Action Plan calls on member states to improve awareness and understanding of antimicrobial resistance, strengthen knowledge through surveillance and research, reduce the incidence of infection, optimize the use of antimicrobial medicines, ensure sustainable investment in countering antimicrobial resistance.
We must engage all sectors, including livestock and fishery, to reduce or eliminate the use of antibiotics unless absolutely necessary.
In 2015, Vietnam signed an aid memoir to combat antimicrobial resistance, recognizing the need for multi-sectoral initiatives.
Infectious diseases remain an important threat to Vietnam and also have an increasingly complicated pattern. The proper use of antibiotics treating these diseases is crucial.
This means that the fight against antibiotic resistance is everybody's responsibilities, and we must bring together the different sectors of societies and coordinate our activity in order to fight antibiotic resistance effectively.
We've come up with a plan to try to address this, because we realize that if we don't do something here urgently in Fiji, it will have an impact on all the people in this country. It's something that's affecting the whole world. As a result of this also, we know that if we do something well here, we can help our smaller brothers in the Pacific. They can learn from us. So we're focusing on getting all the government agencies, all those that can have a part to play in trying to make sure that we minimize the impact of antimicrobial resistance.
To start off, we have to improve the awareness. Most of our people are unaware of the fact that there is quite a significant rate of antimicrobial resistance. I think that information hasn't been relayed to the public.
We conduct vigilant surveillance of resistant pathogens through a joint effort involving both the human and animal health sectors, collaborative One Health approach. We are also supporting other Asian countries to develop in-hospital infection surveillance systems to strengthen its control measures in Asia. Japan is supporting the R&D of new antibiotics and rapid diagnosis tests.
The President decided to create an interagency task force that will look into antimicrobial resistance, come up with a long-term plan, and move forward in putting ways of countering this, expanding the message not only within the Ministry of Health, but making it felt in every Filipino that has been taking antibiotics right and left.
We must handle these critical life-saving medicines with care so they will remain effective for as long as possible. We have a limited window of opportunity for action to change the future and avoid a post-antibiotic era.